Okay, our next topic is going to be the bulb syringe. These should be at the end of your baby's table in your baby's room. Please feel free to use them. They are yours to use. You can practice with them while you're here, and if you have any questions, you can ask your nurse to help show you how to use it. When we go to use our bulb syringe, let's say our baby is spitting up, has milk coming out of the nose, milk coming out of the mouth. We're going to grab our bulb syringe. The very first thing we're going to suction is actually going to be the mouth. A lot of people want to go toward the nose first because milk doesn't belong in a nose. But if you go to the nose first, you're going to startle your baby. And if you startle your baby, then they could swallow any milk that's actually in their mouth and they could aspirate. Remember, always squeeze your bulb syringe in first, and then you're going to go straight along into the back of the mouth to the gum line. We don't go straight to the back of the mouth because, again, it can actually cause them to choke and they could spit up and swallow and aspirate. As you bring it forward to the gum line, you're going to slowly be releasing it and you squirt it out. We want to go against the other gum line, go all the way to the back. As you bring it forward, slowly releasing your bulb syringe and squirt it out. Then we're going to do our baby's nose. If they do have some milk in the front, squeeze it in and you can just go straight in the front, not hardly past the gum line. So don't go to the whole back of the throat, and you can squeeze it, release it, and squirt it out. Now for the baby's nose, we've seen people that try to do the nose and they'll just go right at the very edge where it's barely touching the nose, and that's actually not going to do any good. So we need you to get in the nose. So you're going to squeeze it in, you're going to actually go into the nostril. While it's in there, don't move it and just release it while it's in there. And then you're going to squirt it out. Do the same thing on the other nostril. Go all the way in while it's in there, release it, and squirt it out. Now, there's going to be times you're going to use your bulb syringe for several different reasons. If your baby has a cold, of course, we need to use our bulb syringe to get the congestion out. Babies eat by suck, swallow, breathe pattern. So if they suck, swallow, and they can't breathe, they're not going to eat well. So we need to make sure that our babies, if they're congested, that we clean them out before feeding so that they'll eat well. And then you're also going to use it if your baby spits up. After you use it, you're supposed to clean your bulb syringe after every single use. You're supposed to use the hot, soapy water. So you're going to get the hottest, soapiest water you can. You're going to squeeze that hot, soapy water up into the bulb syringe, shake it up a few times, and squirt it out. And do that about 5 or 6 times really, really well. And then you're going to use hot, plain water. Again, squeezing it, shaking it up, and squirting it out. Do that about 5 or 6 times. After you're done with that, you want to put it straight up and down in either a cup or a dish drain to let all that water run out. These are reusable. The only time I wouldn't reuse your bulb syringe is if your baby has a really bad cold or the flu. I wouldn't reuse it. You stop using it after your baby starts to feel better. So how I describe that is if your baby's temperature breaks and we no longer have a fever, if they don't sound nearly as congested, then you can say, okay, I'm done with this syringe and I'm going to get another one. We'll also give you one on discharge, so you should have at least 2 once you leave here.